John Peters was clearly one of a kind.
He was groundbreaking.
He believed in progress, and he believed progress needed pushing.
John Peters really is considered sort of the father of modern nephrology. He really was instrumental in quantifying measurements of things like urine and blood.
His laboratory was the bedside. He did his research at the bedside trying to understand patients.
Dr. Peters really was a leader in using actual measurements in patients to uncover pathophysiology and to apply the advances in basic physiology to actually see how that could benefit patient care in the real world.
Quantitative Clinical Chemistry was a groundbreaking book. It forced everybody to think in theorems and then test these theorems by doing interesting experiments.
He was sort of an early translational scientist. I think Peters was ahead of his time, and I think he was a visionary.
Peters wanted to speed up the evolutionary process of medical progress through medical science and education with federal funding.
My grandfather had very strong values and felt it was very important that medical care be given to all Americans.
It's interesting to think about current debate and recent healthcare legislation in light of what Peters promoted and pushed for back in the 1930s.
Amidst all of his medical excellence, he was committed to healthcare.
It's this kind of breadth of concern for the health of the entire healthcare system that made John Peters unique and established the legacy for the wonderful recipients we've had for the John Peters Award.
The American Society of Nephrology presents the 2025 John P. Peters Award to Dr. Harold Harv Feldman for his outstanding leadership and extraordinary contributions to nephrology research and education. He is Emeritus Professor of Epidemiology and Medicine at the University of Pennsylvania and Deputy Executive Director for Patient-Centered Research Programs at the Patient-Centered Outcomes Research Institute, PCORI, in Washington, D.C. After obtaining an MD at Boston University and completing his residency and internship at UCLA, Dr. Feldman completed a nephrology fellowship and earned a Master of Science in Clinical Epidemiology at the University of Pennsylvania School of Medicine. Over the next 35 years, he served in numerous faculty and leadership positions at Penn, where he led multiple formal education programs and served as a mentor for over 100 fellows and other trainees. He directed Penn's Center for Clinical Epidemiology and Biostatistics and was chair of its largest basic science department, the Department of Biostatistics, Epidemiology, and Informatics. Dr. Feldman is widely known as one of the first nephrologists to embrace and master the application of clinical epidemiology methods to kidney disease research. He has delivered hundreds of invited lectures at FASN and other national meetings, in addition to numerous talks and collaborations throughout Asia and across the globe. He has authored more than 500 research papers, editorials, and review articles. For more than 20 years, Dr. Feldman held key leadership roles in the NIDDK-sponsored Chronic Renal Insufficiency Cohort, CRIC, study, including National Study Chair. He created a broadly successful infrastructure of investigations by core CRIC investigators and external researchers, resulting in highly impactful findings. Dr. Feldman developed CRIC's Ancillary Studies program, whose unparalleled scope has greatly facilitated collaborations and expansion of research in CKD, yielding many transformative research discoveries. He also chaired NIDDK's Dialysis Access Consortium and its Hemodialysis Fistula Maturation Cohort Study, as well as led the coordinating center of its Chronic Kidney Disease Biomarkers Consortium, among other national appointments. A past president of the American College of Epidemiology, Dr. Feldman served on multiple committees and advisory groups of national and international societies, including ASN, and founded the ISN's global network of CKD cohort studies, INET-CKD. He was an inaugural deputy editor of CJASN and is now serving his second 5-year term as editor-in-chief of the American Journal of Kidney Diseases. In his current role at PCORI, Dr. Feldman oversees all of the Institute's funding programs, their unique integration of engagement with the broader healthcare community, and dissemination of research findings to patients and the public to optimize the impact of funded research on health outcomes. Dr. Harv Feldman's exceptional accomplishments in research, education, and leadership have profoundly impacted the discipline of nephrology. His remarkable productivity, easygoing manner, and career-long deep commitment to helping others achieve their potential continue to serve as an inspiration to students, mentees, and colleagues across the country and around the world, as well as to the Feldman family at home.